Hello everyone, my name is Erica Avery and I'll be presenting this short slide in regards to an emerging and re-emerging infectious disease. The disease we're going to focus on today is the Middle East Respiratory Syndrome. First, we must understand what the Middle East Respiratory Syndrome is. The Middle East Respiratory Syndrome, also known as the acronym MERS, is a viral respiratory disease caused by a novel coronavirus that was first identified in Saudi Arabia in 2012. Approximately 36% of reported patients with MERS have died. In this table or appendix, we can see cases and fatalities that take place in the years of 2013 through 2014. Coronaviruses are a large family of viruses that can cause diseases ranging from the common cold to severe acute respiratory syndrome, also known as the acronym SARS. Typical MERS symptoms include fever, cough, headache, shortness of breath, pneumonia, which is not always present, gastrointestinal symptoms to include stomach pain, vomiting, and diarrhea. Transmission. MERS is a zoonotic virus that is transmitted from animals to humans. The origins of the virus are not fully understood. Although the majority of human cases of MERS have been attributed to human infections, camels are likely to be a major reservoir host and an animal source of MERS infection in humans. However, the exact role of camels in transmission of the virus and the exact routes of transmission are unknown. It has been said that the transmission of the disease to the camel were first from bats. In this slide, you'll notice a graph to the left that has camel mentions among MERS cases by site of acquisition. What we know. The virus does not seem to pass easily from person to person unless there is close contact, such as occurs when providing unprotected care to a patient. No vaccines or specific treatments are currently available. Treatment is supportive and based on the patient's clinical condition. There have been clusters of cases in healthcare facilities where human-to-human transmission appears to be more probable, especially when infection prevention and control policies and practices are inadequate. Prevalence and geographic distribution. The virus appears to be circulating throughout the Arabian Peninsula, primarily in Saudi Arabia, where the majority of the cases are less than 85% and have been reported since 2012. Several cases have been reported outside the Middle East. Most of these infections are believed to have been acquired in the Middle East and then exported outside the region. The ongoing outbreak in the Republic of Korea is the largest outbreak outside of the Middle East. In this chart, you'll see the distribution across the globe. These are confirmed cases of the Middle East Respiratory Syndrome from 2012 to 2015, with the most significant cases reporting in Saudi Arabia and the surrounding regions. Precautions to take. Anyone visiting farms, markets, barns, or other places where camels and other animals are present should practice general hygiene measures, including regular hand washing before and after touching animals, and should avoid contact with sick animals. The consumption of raw or undercooked animal products, including milk and meat, carries a high risk of infection from a variety of organisms that might cause disease in humans. This table and chart just depicts how a zoonotic MERS infection may be acquired from an actively infected camel. Steps to take and to conduct an outbreak investigation. Determine an outbreak is occurring. The biggest question to ask is, what is the problem? What are the signs and/or the symptoms? Is this an increased number for this area, time of year, or age group? Are the cases linked to a common source or agent? Keep in mind that a change in disease monitoring, laboratory diagnostics, reporting requirements, or even increased publicity might affect the number of cases reported without accurately reflecting a true disease outbreak. Next, how many cases are there? The 5 W's of any investigation apply here as well. Who, what, where, when, and why. Once the disease or agent has been confirmed, we need a case definition. who we think is likely to be a part of the outbreak. The next step would be creating a hypothesis based on observation and data we have. We'll then begin the investigation process. The last few steps include testing your hypothesis, studying the patterns of the disease, and creating a case control study. Lastly, and most importantly, taking action. Accurately identifying the risk factors allows us to put in place the appropriate prevention method. Alternate investigation methods include conducting further research and inquiry, providing questionnaires in endemic healthcare facilities and treatment centers, surveying patterns and causative agents, and investigating transmission methods. Wrapping this presentation up, countries, whether or not MERS cases have been reported in them, should maintain a high level of vigilance, especially those with large numbers of travelers or migrant workers returning from the Middle East. Surveillance should continue to be enhanced in these countries. I want to thank you all for your attention and concerns regarding these reemerging and emerging diseases.